Okay, this is April 4th. We're here with Reggie, and Reggie comes to me with a whole myriad of complaints. She's been seen by many other doctors, correct?
Correct.
And you've got a myriad of diagnoses, including chronic fatigue, fibromyalgia, poorly functioning adrenals, poorly functioning thyroid. You've had injuries. You were attacked many years ago. You have brain fog, among a whole sequence of problems, correct?
This is true.
And no one's been able to help you to date.
That's right.
And you've had a lot of treatments. You've even had hormone therapy. All I did with you today, or the main thing I did with you today during the evaluation, was to look at you for what we call interference fields. And we know you had an injury many years ago when you were attacked and you lost a tooth. Can you show the viewer which one? Tooth number 8. And when you were young, you had an appendix problem with a burst appendix. And that led to an extensive surgery. Tooth number 8 happens to be connected to the kidney meridian, which controls the adrenal. And that scar down on your bottom where the appendix is could cut across the stomach meridian and cause other disturbances. Now, you came to me interested in IV therapy.
Yes.
But I said, before we get to IV therapy, we need to check some other things first. Because I'm really cost conscious and I don't want to see you spend money when there's something else that could be knocking off your body's equilibrium. So we treated your appendix scar and we treated your tooth because they tested positive, and other root canals did not test positive, and other scars did not test positive. What happened to you after we just did those 2 scars?
Well, I would say almost immediately I felt relief throughout my body, and I felt actually an ease, a general ease in the way that I feel and the way that I move inside my muscles and throughout my body.
I think you even told me that the soreness, the muscle tightness between your shoulder blades is lifted?
Yes.
That's gone?
Yes.
That's phenomenal to me. You came in with a headache. What's happened with that?
Well, it's almost gone.
Almost gone. Okay. How about the brain fog or the clarity of your thoughts? Has that changed at all?
I would say it's improved.
Okay. There's other issues with that. You may have mercury toxicity too, because you still have an amalgam filling. So you gave me, when we were talking, you told me it was just dramatic what happened to you, right?
Definitely.
And these are with what we might call nebulous complaints. When I say nebulous, I'm not discounting them. People come in here with fibromyalgia, the conventional doctors say, it's all in their head, give them a drug. And you've been given mind-altering drugs, right?
Yes.
All right? So there's nothing that's not real to me when a patient comes in. But these nondescript complaints can be due to a variety of things, including a disturbance in the autonomic nervous system and the energy system of the body. That's why I do an exhaustive search with scars, with teeth, and when you come in here, I want to know what your root canal status is, where your implants are, etc., missing teeth. And we found 2 key things on you that dealt with very traumatic events in your life. And it's quite possible that the treatment that we did today, simply injecting a little bit of local anesthetic, could resolve those 2 disturbances. Now, I explained to you you have an implant. We don't know the status of that.
Right.
But we do know that you got that implant as a result of a physical attack. So that involves memory, neurological memory at the site. And hopefully, the treatment will hold simply by helping to undo the neurological memory. Am I making sense?
Yes.
Now, you still need to clean up your diet. And we're going to do other things, and we'll interview you again because I know you want intravenous ozone therapy. And we'll do that, but you've agreed to clean up your diet, right?
Absolutely.
Okay. May I post this on YouTube?
Sure.
Thank you.